heard something about that.
Scott, I hear your son's
I get a half in
title.
I did not do good.
I can't see you ever officially retiring.
That's
When
crazy.
you're gonna be able to do something.
When I,
Pictures.
Yes. Yeah, we were talking about this the other day.
Pretty amazing.
Yeah.
He was doing some pictures kind of in between professional and stuff for himself. The lighting, he was almost golden colored.
Yeah.
So when he's on stage, it's like black.
Yeah.
Or it wasn't black on stage, but in front of that
Yeah.
banner.
So much for
When I was standing next to him, it was almost black, and
Yeah.
it's just really, this bizarre how different
Yeah.
color he was.
What is it?
Yeah, we
Yes, I do.
Okay, good.
interesting too, you look so much like you, I think.
Oh, well, thank you. I think he's pretty handsome. When I look in the mirror. Yeah. I think we're just about there, so. Well, good morning, everyone. I'd like to call the meeting to order. And we'll go with introductions first, so we know who we're talking with and about. And we'll start with Sammy. We'll go that way around. Yep.
All right, I am Sammy Becker, the Nutrition and Transportation Coordinator at the ADRC.
Jeannie?
Oh, I'm Jeannie Nutter, County Board Supervisor in District 16.
Kevin Adams Dunn, County Board Supervisor, District 7.
Alan Robertson of Blair.
Oh, I forgot to turn my
Iowa Stallings of Ettrick, not quite sure what else, but that's a start.
That's Emery Palmer's district is 6.
Beth Killian from Arcadia. Rachel Harmon from Pleasantville, volunteer.
Laura Boyer, INA worker with the ADRC.
Jessica Rutherford, ADRC Administrative Assistant.
Melissa Youngbauer, ADRC Supervisor.
And I'm Scott Brown from Whitehall. So welcome, everybody. I don't know if we have anyone on, I don't see if there's anyone on TV other than people watching, so welcome to you as well. The open meeting law has been met through the proper posting. We have an agenda in front of us. I'd entertain a motion to approve the agenda.
So moved.
Jeannie moves, or second?
I'll second.
Kevin seconds. All in favor, say aye.
Aye.
Opposed, nay. Motion carries. We have the minutes of the April 11th meeting. Did people get a chance to review that?
No corrections, but
Oh, then we should be good.
we should be.
Were you a teacher in a formal life?
Yes.
No.
Yeah.
So Killian would make a motion to approve those minutes.
Okay, thank you, Beth. Is there a second to Beth's motion? Second. Seconded by Alan Robertson. Thank you. All in favor, say aye.
Aye.
Opposed, nay. Motion carries. Thank you very much. And staffing update.
Sure, just a quick update so people are aware of staffing at the ADRC. Wanted to let everybody know, if you did not know already, that Deb Sukla, who is the Department of Human Services Director, she has retired. So that's been since our last meeting. Her last day was last week. So we do have Jay Hine, who is our Deputy Director. So just wanted to make people aware of that. And then the other opening that I wanted to make people aware of is we do have an INA social worker position that is currently unfilled. So Laura Boyer, who's here with us, and is on the agenda for number 10, who's going to talk a little bit about that INA or social work role. It's another position. Laura is our lead social worker, but it is another social work position that's been open for a few months right now that we've been unable to fill. So just kind of wanted to let people aware of that. So there are 3 of those positions at the ADRC, and we're down 1. That is pretty significant in the way that we do business at the ADRC. So yeah, we've been busy. So just kind of wanting to make people aware of that. And so if you do know of any social workers that might be interested in that position, or if you belong to any organizations where you might have any networking with social workers, certainly let them know of our opening and need.
You're looking at me, so should I?
We would love that, Jeannie. That would be awesome.
I'm old.
I was
No.
just gonna say, I'm not coming out of retirement as much as I'd like to. Okay, thank you. Betty Vold just walked into the room, so
I apologize.
I wasn't,
Parking out there.
No, there isn't.
yeah, it's difficult. Maybe it'll improve once the old hospital clinic building is gone and they can all park over there for their work experience, but that's gonna take a while, so. Yeah, it's not quite as bad as that bridge that came down in Pennsylvania. That was, it's gonna be horrible for those people for months and months. Okay, ADRC council member opening.
So wanted you all to be aware that Ruth Gullicksrud, who was one of our representatives from the Strum area, she resigned about a week or so ago. Many of you know Ruth because she had been on our council for quite some time, and she had not been able to get to a meeting for several months. And she had just contacted us a week or so ago and just said that it was time, that she was no longer able to continue in that role. So what that means is we do have a council opening. Ruth was a representative from the 60 and over category. So we did have a Human Services Board meeting last night, and we talked about that opening at that time as well. So wanting you all to also be aware of that. So if you have any individuals that you know of that may be interested, you know, certainly send them my way, or you can talk to people yourselves. The way that process works then is that it would go before the Human Services Board. When we have a candidate, they would approve that candidate, and then it goes to the full county board. So it does feel like we've kind of been, it's maybe just the way that it goes, I think, perhaps.
A little bit of natural
Yeah,
attrition.
Right. So.
Yep, yep, please.
We also have a little blurb that'll be in our next newsletter that'll say that we're looking for a person to join the council, and we will also advertise that on Facebook. But I do think word of mouth is perhaps one of the best recruitment methods, so. And if anybody has somebody in mind they would like me to call them, let me know.
I'd run into Ruth Halverson a couple of times over the last few months, and she is very interested, but it's the same old thing, that the parking issue, and she had, you know, her mobility is an electric wheelchair, and so she's got to find a place to park a van and then get, you know, her wheelchair out, and so that's been a real concern. Mary Beck has been having some health concerns. I haven't been able to talk with her recently. In fact, I'm not even sure exactly where she is. I had heard that she was kind of recouping at a nursing home down in La Crosse, and I've also heard she might be out here at the healthcare center. So just not sure. I would like to track her down so I can go visit with her and see how she's doing. She had called me at one point just to let me know she was alive and well. Her son Paul was frantic, trying to find her at one point. She was telling me this story, and she said, "Well, Paul, I'm okay." And I mean, that just saying that to your son isn't enough sometimes. You know, I mean, he was just going crazy because he didn't know where she was, didn't hear from her, and but she said that she was fine, but she's got some leg issues and just kind of working on that.
Mr. Chairman?
Yes,
You said you ran into her. Was anybody hurt?
No. We exchanged insurance cards and yeah, I should watch my words, so thank you. Appreciate that. Okay, ADRC council meeting date, time, and potential for change. we've gone back and forth about this for a while. One of the things, meeting on Tuesday, we kind of are behind the Human Services Board meetings. So if we could meet Mondays, that would kind of solve that problem. So then we would, as the advisory council, we would meet, advise, they would act on it, and, it makes a little bit more sense. I don't know if people could meet on Monday mornings, if that's even a possibility. It seems like our bylaws would probably have to be changed. I'd have to go back and look, but I think our bylaws have stated it would be, such and such a Tuesday. So I think we as a group can kind of vote to do that. I don't know if,
Oh, I'm sorry.
I don't know if we have to, do it over 2 or 3 different meetings. Some bylaws are stated that way.
Yeah.
Just not sure if ours is, but
Would you be looking at the Monday, the second Monday, the same day as our Human Services
I
meeting?
don't know. I think I'm just open for discussion. Right. The other option would be to keep the day the same, but just recognizing sometimes we're meeting then right after Human Services Board, so sometimes it's not the best timing. But another thing I think to discuss today then is the actual time, because I've had at least 2 people that have indicated that the meeting time is too late because they like to get to the senior meals. So I think it's just open for discussion, I think.
thoughts?
Pretty much any day works for me. We used to meet at 10, and that would be great with me because I usually end up having to leave for something or other, earlier. But Monday works for me, whatever the group decides.
Especially since we only meet every other month, Mondays will work for me because I have plenty of time to let my employer know for flexibility. So that'd be fine.
Monday works for me. If we met the same day as Human Services, which kind of makes sense. Meet in the morning and Human Services is in the afternoon.
It would save you.
What?
It would save you a trip then, if the meetings are close to each other.
Well, they're not.
Alan?
Mr. Chairman, this will require an amendment of our bylaws.
Yeah, right now we're just sort of discussing. We are
Understood.
to make sure that I, appreciate the input and the amendment, and we haven't done that for a while, so I'll have to figure out how to do it, but is the time also in the bylaws? I was trying to think that, okay, so we'd have
Oh,
to.
it does say what time we meet? Wow. Huh.
When was those bylaws made anyway? How long ago? Just curious.
1492. When Columbus came.
We just revisited the bylaws not too long.
Yeah, I would, right. Yeah, it does say held at 10:30, second
Tuesday.
Tuesday. Yeah. Well, December of 2021, it looks like it was approved,
Yeah, it wasn't that long ago.
right?
Other input? Can we vote today to change the bylaws? I mean, is that, okay. I don't change bylaws very often in the organizations I'm in, so I
We would
needed a little guidance.
probably need to look at the calendar, though, if we wanted it in this room to make sure that it could still be televised.
I'll go check.
Okay.
And
See what else is going on Monday morning.
Okay.
The
Okay.
second Monday.
Right. Any other input as
Any other, yeah, as far
Jeannie
as
is
the time
checking?
is 10, is that what?
10 work out okay for most? Okay. I say we could go on to other things, but I think Jeannie should be a part of that as well.
She's on a mission.
She is. She knows where to go. While she's doing that, I put some of these flyers for the Relay for Life over on the table over there. If any of you in your communities have a place that you could maybe hang one, please feel free to take one along with you. It's coming up on the 23rd of June, a Friday evening from 5 to 10. And this year it's going to be in Eckern Park in Pigeon Falls rather than up at the high school here. We've been having challenges over the years with kind of having to spread out too much. We have, tents with bucket raffles and silent auctions and things, and that always ends up having to go way down in the parking lot, the lower parking lot by the building. And when you're in there, you can't hear what's going on up at the track, and it hasn't been good. So somebody had mentioned to Mary Johnson, who's the very capable kind of lead on this whole thing. We share co-chair, but she's mostly chair, and I just sort of co. And someone said to her, well, why don't you hold it up in Pigeon Falls? We'll let you do whatever you want to do. But that setting is such that even with a tent by the fence down below the shelter, they still would be able to hear what's going on, and it's just a little more condensed. And the people of Pigeon Falls are very open and gracious. And we've got the WEA group, the Whitehall Area Youth Association, is going to do the concessions. And so it's a little bit of a fundraiser for them, and then they're going to donate meals to the survivors. That's their donation to the event. So just found that out last night. So it should be fun. I can't remember I haven't met the person that's going to be our survivor speaker and a caregiver speaker yet. It's kind of some new people to the event, but that's coming up. So that's why I'm wearing the purple with the logo today. Got logo. I'm looking at myself over there, and it's just like, what the heck? I'm pointing the wrong way. So what have the two of you found out?
Well, property meets the second Monday, and
Oh.
sometimes they're an hour long, sometimes they're an hour and 50 minutes long. So we'd have to meet later on Monday. Maybe right before, I don't know if you can do in the afternoon, right before human services, I don't know.
Are people open Monday afternoons?
I'm open.
I just want to make sure that, because a lot of people like to watch this meeting, and if you're older and you can't get out,
Right.
you can watch it on TV and see what's going on, so.
Another option might be meeting on the first Monday of the month.
Yeah, that's exec finance then.
Oh, okay.
Those meetings can be really long.
This is a
Or they
busy-
can be
busy
really
place.
short.
It is a busy place.
Yep.
Afternoon works.
Rachel, you were shaking your head no. Does that?
No,
Oh,
it's fine.
okay. Had to be sure that this was okay.
I don't know, what do you think? You're the boss of us.
I'm not the boss of anybody.
Yeah, I don't know. It seems like it could be an option just to move the time up as well. I'm really the first person that's ever said, this seems to be kind of a odd situation where we're meeting, the day after the
Right.
board.
And if we have something we want to go to the Human Services Committee, you have to wait a whole month.
Right, right.
Until we
Yeah.
can bring it to them.
But being that I'm the only one that's ever brought that up, maybe it's not an issue.
I think it's a valid concern.
Okay.
Yeah, P-TED is in the morning.
Yeah, since we're, advising, and it'd be nice to have your voice represented. And so,
I think Melissa does have a valid concern about having it, either 11 a.m. or that afternoon. So if we have something, we're not a month behind.
Yep. In order to amend the bylaws, I'm going to read the paragraph. These bylaws may be amended by a majority vote of the TCSSAC members. Notice of the proposed bylaw changes shall be made to the membership at least 1 week prior to their consideration. A majority of the total membership appointed is needed to approve any changes to the bylaws. Trempealeau County Corporation Council shall receive a copy of the proposed changes to the bylaws. So discussion today, we'd have to let everybody know the next meeting that we would be, taking that into consideration. So we'll have to wait 2 more months in order for that to pass, so.
So couldn't we just delete that from the bylaws so we have more flexibility in scheduling times for meetings?
Nope, he says no.
This man is a trained lawyer, so he knows things we don't. Well, retired trained lawyer. Yep,
It seems
consultant.
like a goofy thing to have in the bylaws when you meet, but,
You're unofficial legal.
so we can't really make a
Make a
decision
decision
today.
today.
Nope. We can
So we
make the recommendation of the date and time to be voted on at our next meeting. That we should have, because we'd have to let everybody know a week ahead at least. So when Jessica sends out the minutes and the agenda, that would be something that would need to be stated. So if we're looking at, what are we looking at now, the first Monday? No, the second
Second
Monday
Monday.
at 1, is it?
Well,
Or you said 11?
just for my own,
Yeah.
it's all about me. If it was closer to the human services, if it's at 1, then I gotta hang around here till 4. Or go home and drive back, which is, 28 miles round trip. Whatever, I can be flexible. Either in the morning, well, it can't be unless, if we do morning, it has to be late, like noon. Because you don't wanna be standing in
Which
the hallway
seems-
while
Yeah.
property committee is meeting.
So I'd be very open to the early afternoon, late morning, definitely.
You have a place you can hang out for,
Yeah, I can
Few
go to,
hours.
Sweet Temptations,
Yeah,
they
I was just gonna
close
say
at
that.
2, so that doesn't work either. No, whatever.
yeah,
This place.
and the cafe's closed on Mondays. Quick Trip
Yeah, a lot of us go over there for Taco
Hang out at the
Tuesday.
ADRC.
Oh, yeah,
on a Monday,
I can be a
No, on Tuesday.
volunteer, I can
Yeah.
answer the phone.
but if we're doing the Monday,
Take it.
Well, y'all go on lunch, I'll be there.
There you go. Lunch cover.
so what do you think then, the second Tuesday at 1 rather than at noon?
Monday,
Monday? Oh, Monday. Did you say
think he
noon,
said
1? I said 1, but,
not noon, because that's, you all are
It's
at
at
lunch
our
and
time.
stuff like that.
Well, and you still want the people to go to the meal sites, right? That was part of the problem too.
Are there
Although
meal
there's
sites at
already
1? Or, I mean, on Monday?
Boondocks.
Oh, yeah, just
Yeah, just
Boondocks,
Boondocks.
yeah.
Yep.
Boondocks is the only one that has Mondays?
Never mind.
Yep.
Forget what I said.
so recommending second Monday at 1 PM.
So that's what the agenda would say.
Yes, that would be what we would be voting on next meeting. Change of day and time. Any other discussion? Can't vote on it today, so. Probably don't need to vote on it to put it on the agenda, so. Okay. ADRC driver shortages.
Okay. We're gonna let Sammy, our nutrition and transportation coordinator, take the lead on this conversation. Just we'll start out by saying we have had several, meetings and discussions between Jay, Deb, Sammy, and I over the last month or so, and so not a lot of easy answers, so just wanted you all to kind of be aware of what we are facing and get input about this situation. So we'll just let Sammy, take the lead.
Sounds good. Thanks, Melissa. So yeah, we have a major driver shortage, which has resulted in our ADRC staff having to leave and do meal routes, or declining trips. We've had to turn away quite a few trips. A lot, we really try to focus on getting as many private pay trips scheduled for people, versus the family care ones that they have more options. So we are having to send those back more and more. And again, our staff having to leave, to also do those shorter local trips. You know, we have some people that go weekly to, say, the hair salon or something, and we just don't have a driver to do it. So we've had, you know, Jessica or myself have to leave and take that time to go help them out weekly. And then our main priority is getting our home delivered meals delivered. And that we've had probably, I'd say, the biggest struggle, as for me at least, is having to deal with getting those drivers arranged. And we've been having to pull our main local driver to do a lot of those routes, and just resulting in, again, having to turn away more and more people for their trips, medical, shopping, things like that. Also, it's led to some staff burnout. We've had having to decline these people, deal with backlash from people, deal with backlash from family care, providers. Sometimes our drivers get a little frustrated because their schedule changes like that. And again, like I said, our main priority is getting those home delivered meals out. So pulling our main local one, turning away a lot of our smaller local trips, and getting those taken care of. So what we've tried is we've had a job posting for our paid driver position advertised for probably the last 2 years at least. We've recently increased our driver pay, so we're more competitive with surrounding counties. We've kind of equaled out to what they're paying their drivers. What else have we done? We've started meeting with local Lions clubs. I meet with the Pigeon Falls Lions Club next Monday to discuss if they have any ideas on how to recruit volunteers, see if they can help spread the word. And I've also met with our transportation consultant through the state, through GWAR. He gave a series of suggestions on how to recruit volunteers, and we've done all of them. We've been doing all of them. Some of them include the radio station, newspapers, advertising at meal sites, churches, putting them in their bulletins, increasing our pay, and we've also approached schools. We've had White House School and Blair School this last, I don't know how many months it was, but most of the school year. Blair took 1 day for meal routes, and then the National Honor Society for the school here in Whitehall had a day, and then we had another teacher with a student that would go out 1 day a week as well. And they all loved it, but now summer's here, and so we have all those dates open and nobody to take their places.
Get all those school bus drivers that are working.
Yeah, I mean, that is
because that's kind of your competition, is because they're having a hard time getting drivers as well.
Yeah,
so.
I think everybody's having a little bit of a hard time. So not getting much for feedback as far as the job posting, the search for volunteers. We're just not getting the answers that we need. We've spoke with other counties in the area, surrounding counties, and they're having the same issues. Nobody in these rural areas can get anybody to volunteer to drive. And And then, like I said, we're having to put priority of, do people go to the doctor or do they get a meal? And that's been kind of a big struggle as well, so.
I think what the cause of this, people not wanting to volunteer work, I mean, it happened before the pandemic, but I think the pandemic just made it 10 times worse. People like after the pandemic just gave up. They just checked out. So the pandemic has had a lot of negative effects, especially in the rural area.
With the volunteer drivers, Sammy, they get a kind of a mileage check type of thing. I mean,
Yep.
it's not total volunteer. You don't pay for your own gas. Well, I mean, you buy your own gas, but I mean, you get mileage back.
Yep, so we have our paid volunteer position open where they're a paid employee. And then we have the volunteer where you can get paid mileage. So yeah, you just keep track of your mileage, turn it in, and we we reimburse you for mileage, so.
You know, is that considered taxable or non-taxable to people? Do you
Those are
have an
some-
idea?
Yeah, we suggest people to even contact their, their tax professionals, because some of the questions get really, they're a challenge to answer, and it can be based on your age, a lot of different things. So, for the most part, it is taxable.
So you give a 1099 to the people that do, oh, okay.
Yeah.
So, yeah, but it's probably not much.
Yeah, I don't know the specifics of that.
I'm just
You know,
guessing,
Stacy up in the clerk's office gets people set up as, the vendors, and, yeah, it's,
Maybe that's more for her or even a tax person to know more about.
right.
Even beyond the clerk's, I think the clerk's office probably have more idea than we would. And outside that would be a tax person. Because
Yeah.
some people in the clerk's office have some accounting background, so maybe
Right.
they want to ask.
Right. So I guess, we wanted to just give you this information, because it is something that we're dealing with every day. And Jessica is, here with us too, and she does a lot of the transportation calls and scheduling. So, if things don't change, we're just kind of letting you know that we really may need to take a look at some of the services we provide. Because there is a significant increase in the demand
Right.
for all of the services we're providing.
Is there an age limit to be a volunteer? Like when you were
You have
talking
to be
about
18.
Okay, that's what I thought. So the students that did it were 18.
Yes.
Okay.
Or if they were with the teacher, they
Yeah,
could be
right, yeah.
younger.
There's just got to be, like, basically a supervisor with them.
Okay.
Right.
So if you have a mom and daughter situation,
Yeah.
or
Or even an older student that's over 18 could take one of his buddies that may be younger.
Yes, yep.
Because he'd be like, if anything goes wrong, he's in charge. Makes
Yeah,
sense.
that is what,
Basically, with the-
yeah, with the
something
National
hits the
Honor
fan, it
Society.
sits on him.
Yeah, we
Never
started
mind.
out and there
His-
was,
His buddy behaved.
yep, one 18-year-old, yeah, with several 17-year-olds, yeah.
He'd be like I said, you have to be very clear to that 18-year-old. Which you probably would know. You got to keep your buddies in line because it falls on you as the quote lead. So because you're over 18, there's a lot of responsibility.
Right.
That's a good way to introduce yourself to adulthood too, a little.
So I guess if there's any discussion, otherwise, I think this is maybe just the point where you got a handout that says transportation fees and county comparisons. Wanting you to kind of be aware of where we are currently at with what we are charging for our local trips and our bus trips. So I think we are at this point just wanting some feedback about what you think about these fees, and yeah, would like to hear what your thoughts are. As you can see, we are lower than most, if not all, of the neighboring counties. We do feel like overall, and Jess and Sam, you can jump in if you'd like to, But I do feel, for example, looking at our local trips, the fee is so low. I think most people that I even tell what the fee is, they're like, oh my gosh. We tend to see a lot of people that are using our transportation every week. So they're using it more often, I think they would, than if it was a little bit higher. And what I'm just suggesting is that if it was a little bit higher, people would maybe plan out a little bit instead of going to, Randy's every week. Even going every other week could be doable, and it would decrease the number of requests that we receive. If that makes sense? If anybody has any questions about that?
Could we do maybe even $2? I think people are afraid, even though we're the lowest. I can hear if we raise it, people are gonna be upset, especially in these inflationary times. I could see blowback.
Inflation is down today,
But I mean,
just so you know.
but I mean in general, in this economy, I'm afraid we might get blowback.
And I think that's exactly what we're wanting, is we're wanting your feedback so that we can bring this then to the Human Services Board next time.
So I could see a little bit, but no matter how much we raise it, I could see that people getting concerned about that. It's already high inflation or a little bit of a bounce. Iffy economic times, you're gonna raise it on us, especially in these times. I already hear community members just say that in general with other things, so.
I think Laura has her finger on the.
Well, I just
button.
wanted to confirm that. I think we all understand what Kevin is saying, but also listening to what Melissa is saying, the viability of these programs is at risk right now. And if we don't make some kind of change, I think that there may be no local transportation. There may be, we need to really, or you guys, it's the advisory board or the human services board, we need to look at how to make these more viable programs. And I don't know, we don't have the volunteers coming in, so we've had positions listed for 2 years and nobody's applying for these positions. So what other changes can we make to keep these programs going? Because obviously they're important, right? A lot of people are using them. So what can we do different?
I'm just gonna mention, so looking at our numbers last year, we did 1,870 local trips. So almost 2,000 trips.
Right.
That's all in county, mainly van service.
Right.
Yep, so I didn't mean to cut you
No,
off.
you know me, I always go back to that GWAR study that talked about the isolation of our seniors, and I don't know if the people really fully grasp the seriousness of how the seniors in our world here in Trempealeau County are living so isolated, and if we can't support them to get them out, that's one of my pleas in the PTED committee when I talk about how we want to increase activities at the park to include, and I talk about, okay, the ADRC can bring people to the park for things specifically for adults, seniors, and if we don't have anybody to bring them there, that's not going to happen. So I don't know if we have to make a better plea to the public to help them understand, like an article in the Times, Debbie Foss, she's not ever at these meetings to hear about and she hasn't been at I don't know if she's still even working for the Times. But I feel like there's misinformation, lack of information, people not understanding that this is a critical point we're at. We're either going to help our seniors get out, or they're going to just sit in their house, and we're going to see suicide rates jump higher than they already are. So this is like danger zone for me. And I don't, we preach to the choir here, and we same at Human Services. And
these local trips, they do include medical appointments. A lot of them are medical, they're going to the therapist, they're going to the doctor, but they're also beauty shop, they're going to the bank, they're going to grocery stores, all of those things.
Well, and the beauty shop may even be more important than a doctor's appointment for some people, some women,
It's mental health.
Yeah.
I just want to interject a little something, because I've used the services now. I can say that I've actually, they picked me up and the whole 9 yard, and there was some confusion in it, but it all came together at the end. The thing that I made a point to Melissa when I talked to her about it, because I thought I wanted to volunteer and do that, so I did a couple of rides. It was very pleasant. For me, though, I'm going to be very honest with you. First of all, I probably watch the news way too much. You know what I mean? Because that also put up like a big caution sign up, because I'm a senior citizen as well. And where this is really rural America, I had no, you know what I mean? I'm not trying to be funny, but
No.
I won't say a city girl, but I lived in,
Urban.
yeah, there you go. And so, and it's beautiful, but it's also dangerous. You know what I mean? And everything is so isolated, because on those trips, some places those people were living, beautiful country, but they're out there by themselves, and it's like, oh my God, you know how do you do that? I have 2 dogs. You know what I mean? Because I don't have family, and they're slowly dwindling away, one person at a time, and so because of that, I wonder if I could maybe have somebody who would ride with me. I would be more than happy to do that. But by myself, I don't think that's safe.
No, I
agree.
appreciate your comments, Iola, and I do think, we do a good job of just saying, it's so awesome. It's a wonderful, it makes my day when I do it, and it's a great thing to do, right, for your community.
Correct.
But it's hard too. I mean, it's a lot of great things, but it is a challenge.
And
so those
yeah.
home delivered meals, I think like part of what you're referring to is it's a meal, but it's a safety check. And so if somebody's not answering that door, our protocol is you go in. And so what she's saying is,
as a black woman in a rural area, or even a black man, no offense, as a person of color, that's not going to fly.
But
We'll be shot in
even
the
a
spot.
man, we have had recently just person that a customer that got very, very upset. It happens, even though we tell them when they sign up for meals, this is our protocol. We have to do this.
And no offense, and this
Yeah.
maybe I watch too many news, but it's bad enough a white person walking in, but if someone of a color, especially one walks in, I hate to say it, but they're going to probably think even less about, I hate to say it, they really would be more upset. Maybe
Well,
I'm watching too much news.
Maybe we should think about team driving.
Yeah,
Yes.
team,
Working
yep.
together as teams, and maybe that's
that'll
what
not end up
stops
well.
people, because they feel alone and
And
don't.
it's an isolated trip, because
Right.
the way where they took me on both times that I traveled with everybody, like I said, the countryside is absolutely gorgeous. I love it.
That's why you moved.
You're right, but at the same token, you're dealing with stuff I hear that the average person just does not see.
And no phone service, even if you found somebody
That's
that
right,
needed help, you
exactly.
might not be able to
That
call
is-
anyone.
That is, and
And so
that all
puts a
makes
damper on how you
sense.
get-
That does all make sense, but again, most of our trips were already short, and we've got one person.
Right.
So,
But
No, I'm
you
just
cover a lot
thinking
of
if we could
territory.
advertise it as a new thing, we're gonna team these things, maybe people who have been holding back because they're afraid, they don't wanna go out, they don't wanna go alone. If we, I
You're
don't know.
talking about senior citizens going out there by themselves
Yeah.
as well, because I'm a senior citizen officially for real.
Right.
And so, but I have the energy and just got a really good clean bill of health from my provider. So I have the energy and have the stamina to be able to get out and do those things, but I want to keep that status. You know what I mean? And so that means that I won't go necessarily out in
Right, alone.
Ettrick and places I didn't know existed that were part of Ettrick. I was like, really? And so that's something I think we maybe need to consider is if I can find me a volunteer, like a friend of mine who might want to ride with me sometime just on occasion, I would be more willing to do it.
I'd ride with you sometimes if I'm not at a meeting.
Yeah, you sound way too busy for me.
No, but I mean, just
No, but yeah.
let
I
me
would-
know. I mean, I'd like to fit this into my schedule, but it gets a little hectic, so.
You and Jeannie would be kin. You guys are a lot alike.
Oh, well, I mean, because I would, sure. You know what I mean? But I
We could put our
I'll be honest
dogs
with
in
you.
the back seat.
I know.
I have 2
I
dogs
don't
too,
know.
so.
they kind of wild and woolly. I would get away from them. That's how I'm going away. That's my way of getting away, because they feel like they got to wrap around the leg and drag across.
I don't know if they are.
No, but I think there's some creative
yeah.
things we could do to think about, making it exciting.
Beth
We've
Beth
been
has an idea.
trying, yes.
I know they have,
Yeah.
When we advertise for transportation drivers, I don't know if people understand what we're looking for. I guess I myself don't really understand what the role would be. Not that I'm going to jump in and say, yeah, I'll do it, because I've thought about it. But what's the criteria of what you have to do? So if you're a meal provider, where would you go to get the meals? Do you
So
have
if
to be?
you're asking if you're a meal driver, if you're.
Right.
Yeah.
When we put the article out, what would you be doing? Or if you're going to be just a local driver, you'd go to somebody's house, pick them up, and take them to the grocery store, and then take them back home, so that people would know what the job is.
So I feel like just having those conversations with as many people as we can. So like what Sammy talked about, getting to meet with Lions. But we have continued to do those conversations. We do those conversations at meal sites. We've talked to a lot of people. And for whatever reason, when they find out even what it involves, I think it's just, yeah.
Yikes.
So.
All of you out there in television land, you're eligible for being drivers too, so give Melissa a call.
And I think it has to do some with the political landscape too in the times. I'm sure that's not helping, especially when people watch too much news. I'm sure that's adding.
Well, I don't think we advertise what political party we are when we're delivering a
But-
meal.
but
We
what
just.
that's not what I meant. People watch the news and they hear like shootings. That's what I meant.
Oh.
Just the environment generally in the country is what I meant. That's going to turn people. They hear of in a rural area, and everybody's no surprise that in a rural area you probably like our guns more than urban people. And then you can see why some senior citizens wouldn't want to just go to a home and possibly have to deal with that, especially as a woman.
I just walk in the house, and I'm looking, I'm going to say, I'm not doing that.
No.
You know what I mean? And not because I don't, there's nothing in there that I don't want, because that's some stuff at my own house I don't want. But I'm just saying, we've got to figure out a way, if you can partner for safety purposes, because this is the time we're living in right now. You know what I mean? And I know it's part of it is color, but not all of it. They play on senior citizens. Hey, look, my son, they call me, my family called me from Atlanta and said, be careful, because, they're kidnapping old people too. And I'm thinking, what? You know what I mean? So you have to, those are things that really we need to look at the safety portion.
So
of
what
it.
I'm hearing is when we do talk to people, we can suggest, like we have already, I think, to some extent, and we do have, like all of the school, a lot of the businesses, there's partners that do it. So, but we can certainly, let people know that. But I guess at this point, it would be helpful if any of you would, again, as organizations you belong to, when you're talking to people, just letting them know about this. It's really a dire need. Because we are having conversations about we can't continue to operate the same way we are right now. So.
And I think it's just something to add on to it. These drivers that do these routes every day, they know these people. These people know them. They know their pets. They know their, you're not just.
Know their grandkids.
But you're not just walking into a random
Right.
house every day. If you can get on a route and do, even if it's one day a week, but you're doing that route consistently one day a week, these people know you. I think that's a thing to stress too, is you get to know these people. I've
Right.
done, 3-4 different routes, and I know all of them on there. They know me, they recognize me, and so I think if you can preach that a little bit, I think, it's scary, yes, it is, but I think you do also get to know these people and their habits and.
That's a good
And
good
when you
point,
go
Sandy.
in, you know, we've had drivers that, you know, they do the same route every single day, and then somebody doesn't answer and they go into that house, you know, they know that that's not their pattern, and you know, it's, I guess, I don't know, I think that's a thing to remember too.
I just wanted to add that sometimes those drivers, because they go to those homes day after day, have even reported changes that they've noticed with their constituents that they deliver meals to. So we've had drivers come back and just express concerns like, so-and-so looked not well today, and tried to talk to them, and they, you know, said, yes, they're having X, Y, and Z symptoms or whatever, but they hadn't done anything about it. And so, but had given us permission to reach out to family members and just express concerns. So it's not always that the drivers go there and find somebody, you know, unconscious or something like that, but sometimes it's just like they're noting that there's changes or that they weren't quite tracking well today or whatever. So those are also important pieces, I think, to those drivers being in, you know, a part of those.
How rare is it, or how often does it happen where you have a driver and or volunteer go to a house and they find someone unconscious where they do have to call the fire department or an ambulance? Is that pretty rare?
It's happened a few times.
Yeah, I don't think that they've been unconscious in the last 2 years,
maybe
but
fallen
I would say
or-
You have to
fallen,
call the
fallen
rescue
probably
squad.
once every 6 months or so,
Rescue squad,
3
yeah.
months. Yeah, that
I'd say
happens.
maybe 3 months,
Yeah,
yeah.
that happens quite often.
So, and in addition to that, and what do we do about the volunteers is we lessen the days, you know, we deliver meals 5 days a week, Monday through Friday. Do we lessen the days that we deliver to be able to have more drivers? You know, we deliver Tuesday, Wednesday, Thursday. They still get 5, you know, a week's worth of meals. They're just getting 2 meals on a certain day.
Oh, okay.
Is that an option that we do? But then, like Melissa said, it's as much of a meal as it is a check too. And now that's maybe 2 days a week they're not getting checked on by anybody, so.
But a plan, something like that, would free up drivers a lot.
Do some of the folks that are being delivered to have the capacity of calling in? Like on, you know, if you deliver Monday for Monday, Tuesday, Wednesday for Wednesday, Thursday, Friday for weekend, then they would call somebody on those opposite days just to be sure that they're okay?
I don't think we would have the staffing capacity
No. Okay.
to do something like
No.
that.
And some of these people, they don't have family. They don't have anybody to check on them.
That's my dream position in the ADRC is a home visitor. But, you know.
I'll go with you. I mean, you know what I mean? Because I would do that. You know what I mean? Because I don't work. And so, and well, I do, but not really. Just anyway.
You're involved with organization, that's how I met you, so you can't say you're not completely.
Yeah, so, you know, but I mean, I would be willing to do that with someone, you know what I mean, to do a home visit or something like that. I would be more than happy to do it with someone else, but I wouldn't do it by myself. You know, because even though we went and we talked to them and they got to meet me and everything, maybe it was just me, but there was a little uneasiness about that. But I figure over time, if you see me enough, that would change.
Just getting to know you. Yeah.
Right, but I still would like that partnering to me is a safety factor, because let me tell you, them places was out in the boonies for me. You know, I'm just beautiful, but it was in the country, and I'm just not used to that. That's just like, what in the world? It's a house out here? But
Thanks,
I'm
Rachel.
just, you know,
Thanks,
but I
Rachel.
would
Good day.
love to do it with somebody else. Bye. But I would go with somebody. That would be I wouldn't hesitate, because it was fun.
Yeah, it's
It really was a
fulfilling.
lot of fun,
What's the
honestly.
age cutoff for the meal delivery, 62 or 55? 60, to get a meal
You have to
delivered?
be 60.
60, oh, somewhere in between.
Yep.
And homebound
Oh, and home.
to get a meal delivered.
Yeah,
Yep.
otherwise you go to the meal sites.
Yep, 60 and homebound,
And
or a
60
caregiver for somebody
And
that's
also, what about
homebound.
the meal sites, you have to be 60?
Yes.
Yes.
All right. So I know some people that are either over it or getting close, so that's an option, I can let them know. They're approaching 60.
Do people have any feedback about what Sammy just brought up about possibly reducing the days that we deliver meals?
I don't like it, but it's, because it's, the driver is the only person they may see, in their life. But as long as they're getting food, that's my thing. You cannot not have food.
I agree. As much I don't
So-
like the days being cut, as long as they get food, I hate to say it's better than the service is completely cut.
Is there an option to like partner with these, have all the, like Trempealeau, Buffalo, Pepin, have a thing together to talk about, some kind of forum somewhere? We need, to express to our communities what a dire situation this is.
Or
Because they're all in the same boat.
what about, I know, maybe somebody from this council maybe go to our counterparts in these counties and share ideas or whatever, because we're all in the
Well,
Well, we
same.
do
do
all
have
do
some
that.
of that, yeah. Sammy meets with her counterparts. There's a lot of there's meetings, but there's a lot of just email exchanges where people will throw out, what are you doing about this? That happens really. like,
Regularly,
Yeah.
yeah.
every
Guar
week.
help organize some kind of conference on
Well, they do.
driving,
Sammy
specifically just for helping these rural counties bring people together to talk about our need for seniors, and one of them is we need people to help us with transportation.
Well, Sammy just.
I do meet, I just went to a conference, WAND conference, and they talked about the need for that there, and a lot of meal site talk too, but I also meet with my region of Guar monthly, and it's really just an open discussion on, what's going on here, what's going on there, what are you doing, what's not working.
But we're always preaching to each other. I mean, if Guar would do one of those and invite the public, I don't know how you'd bring them in if you can't get them to help us with
Right,
volunteers.
yeah.
How do you get them there? A free meal? I don't know, something.
Because that's what, I feel like we're connected enough with people in the state, we're doing things that,
It's just
like,
getting the community to
even
be involved.
like with
Exactly.
the recent increase in wage, that is something that kind of came about just because of this. I think everybody has had to raise their wage, or most people have.
Do a show on WCCO, We need.
I think we are
we're
doing one
right now.
We are doing one,
Oh,
yeah,
good.
It is scheduled.
Yeah.
Is it August?
I think
And
I
have
think
some
it's
drivers talk
August.
about and that you do get reimbursed. Maybe when you hear the word volunteer, you don't realize. I mean, sometimes you just scan over an ad, you don't see that you get reimbursed. I don't know. Somebody call in right now and tell us why people don't volunteer.
Text Jeannie. Yeah, it's something we're not going to solve today, obviously, but a
True.
lot of good input. Thank you all for your ideas, and I guess, Sammy, you may have to do the 3 days a week or 2 days a week or something to deliver, just because of the shortage, and I think we as a group would support that, but we all know that 5 days a week is the gold standard, something we would love to continue to shoot for. But everybody keep thinking about it, talk to friends, talk to relatives, talk to your groups, your churches.
Yep.
Get the word out there, and if you have ideas after the meeting today, give Sammy or Melissa a call, and with some ideas or some names of people. I think that would be great. I want to move it along so Laura
Yeah.
gets a chance to speak to us. So, Laura.
Yeah, just go ahead, Laura. Yeah.
I guess I didn't really need an introduction, but
sorry.
again, I'm Laura from the Aging and Disability Resource Center. I'm one of the intake and assistance workers. I've been at the ADRC for about 9 years. And interestingly enough, when I first started at the ADRC, we had 4 intake workers, and now we're down to 3 positions, but we only have 2 staff members. hired actually doing the intake and assistance job. We have, I'm not sure how that fourth position was eliminated a few years ago, just somebody had left and that position was never refilled.
Yeah, I don't remember. That might have been before my time.
It's been since I've been here, so
10 years?
I've been here 9. I would say it's probably been in the last 4 or 5 years that that position was emptied and never refilled, and so then we've just been working with 3. In November of last year, one of our INA workers had left to take another position, so then we were down to 2 workers. In March, one of the other INA workers had taken a different position, so then for a couple of months, it was just me doing the INA stuff. In that time now, we've got another worker that was hired to do the INA stuff. So for the last couple of months, we've had 2 of us. We still have an unfilled INA position, which, you know, it just makes things really busy. You do the best that you can with the calls and the work that you have to do, but that position, that INA position's been posted for months, and we haven't even had any applicants, or we've had.
It's a social work position.
It's a social work position, yep. But what does INA, what does intake and assistance mean? Betty could probably tell you. She was our receptionist for a little while, and when the calls come into the ADRC, and it's kind of changed throughout the years since I've been here, but when the calls come into the ADRC and people are saying, I need information about rental assistance, or I need information about budget assistance. Yeah, pretty much anything. Those calls will come to the INA worker, and then we sort of try to figure out what sort of resources are out there to try to help this person. Sometimes there are no resources, and so, you know, you try to give them the best information that you can. Otherwise, it's trying to connect them with, you know, we have a resource guide that we can provide, and, you know, that to people. If you have the resources, you're looking for home care, and you have the resources to pay for home care, we've got a private pay agency listing that we can provide to people. We do go out and do home visits, because many people prefer that we come to their home. You know, maybe mobility and transportation is an issue, so we do travel throughout the county doing home visits, trying to provide resources and information to people. Some of the things that we talk to people about include the private pay options counseling, which is like, how can I get home care into my home, which, guess what? That's an issue too, because all of these home care agencies are also short-staffed. So we have areas in Trempealeau County, specifically Trempealeau, that is like in Dodge, Pine Creek area. There's just Arcadia. There's not a lot of workers down there. So when people are calling in and they're looking for home care in those areas, it's really tough to try to help them find home care. Nursing homes are cutting back beds and are maxed out on the bed availability. I mean, it's really a dire situation for all of these programs that we provide through the ADRC. So we provide private pay options counseling. If people don't have the ability to pay for their own services, we talk to them about what that might look like. Medicaid eligibility. We assist with Medicaid applications. We try to work with people to get them involved with the family care or IRIS programs that we have available in Trempealeau County. We help people with housing options if they need assistance with housing applications, homelessness. We have youth that are in our schools that have developmental disabilities or other disabilities, so we sometimes get referrals from the schools for youth in transition, and so that again is like a Medicaid eligibility thing, guardianship, and getting them involved with a family care or an IRIS program. So yeah, one of the things I wanted to talk about is, I know that people talk a lot about the rent that we pay at the building that the ADRC is at right now and how much it costs the county. But I just wanted to put a little smidgen of a plug in about that building. The accessibility, people can park right at our building, and they can walk into that building and not have to go through security. They're not parking. When we were in the courthouse, the only handicap parking was down on the corner on Hobson Street. And
I don't even think there was an accessible curb there.
I was gonna say, I'm not even
I don't
sure,
think there is.
right. So we had so many people, A, not being able to find parking, and then B, parking and then having to make their way into the courthouse, go through security to come in to see somebody at the ADRC. So, if nothing else, we do really like that little building over there because we are readily available. People can park at the building, they can walk right in, and they can see us, and there's not all these barriers to the people to come and see
Wow.
us at the ADRC.
Who's complaining?
Certain county board members.
I don't know, I shouldn't say
Finance.
complaining. I just have heard discussions about
Well,
the
they should just
cost of.
zip it. It's a perfect place, and it's where it should be right now.
And no offense, I'm probably getting on a tirade here a little bit and turning a little bit of a genie, but a lot of those county board members or constituents that are saying that come from a background where they have money, just to be honest.
The only other thing that I wanted to say was in 2022, we had 280 official referrals to the ADRC. So that means 280 people that we either provided private pay options counseling to, we did functional screens or Medicaid applications for, we did disenrollment counseling for family care or IRIS, nursing home relocation kinds of things. And in 2023, so far, we've had 124 referrals for those kinds of services, which is not quite, we're almost halfway through the year. We're not quite to that same number as we were in 2022, but the phones are ringing a lot, and we are super busy. I think the numbers are maybe not what they used to be, but our staffing also is not what it used to be. So,
I will just say, Laura, so looking at 2022, there were 6,400 calls to the ADRC for the information and assistance. So 6,400, that's a lot of calls. So what she's saying is that these numbers that she just gave, those are those more in-depth, many of them enrolling them in that family care programming, which is, it's a process.
it's
There's
a
lot of
process.
work
If we
that goes
get an
along with
actual
it.
referral, so these 124 people that we've received as referrals for 2023, I tell people when I meet with them, that process is a 4 to 6 week process. Because that Medicaid application can be, depending upon how much stuff you have, that can be kind of daunting. And we help people with that application process. And then to enroll somebody into a managed care program is a functional assessment. And, it can be 2 to 3 visits, home visits, to get the whole process pulled together. And so when you're talking about 124 people
lot.
and 4 to 6 weeks, involved in each person that's on that caseload. With 2 staff, yeah, it's busy.
Well, we're an aging county, so
What did we say? I think we still have at least, I think it's 5 years yet before the baby boomers generation is actually all turned 65. Maybe.
Really?
Something
My
like
parents are
that.
both baby boomers or the borderline baby boomers, so I know. My
And
parents' generation.
I think that's, these conversations about nutrition and transportation too, we are seeing that steady climb. So it's,
Can I ask you a question? If say for instance, you get someone and they get trained and comfortable with their responsibility, would they be able to work from home by chance?
I mean, is that flexibility would that be, flexibility be available?
Yeah, we
for
have,
them?
the Human Services has policies in place where we can work remote or we can work an adjusted work schedule.
Okay.
So that actually started before COVID, so we were kind of already, yeah, we were,
Oh,
yeah.
okay.
The standard, the gold standard.
So when COVID hit, you already had things in place.
Yeah, yeah, we were ahead of a lot of places, so.
So do you advertise that in your when you do the job
I believe they do.
Yeah,
I'm
they
trying to
do,
get out.
and
Yeah.
I think that's,
Is that in
that's
the
with
list?
all of the county,
Hired a
right?
Recruiter to see if
Yeah.
And the reason why I ask that question is because there's some people that I know are looking for jobs, but they don't live in the area. You know what I
Yeah.
mean? So
I
if there
think-
was,
Yeah.
they could start off, get the full training, whatever kind of certification you might want to put on them to let them know, okay, you
Right.
passed the test, you can do what you needed to do,
they'd
and.
have to be a certified social worker.
You have to be,
Oh,
yeah.
okay, all right, there you go, okay,
In this INA position, you do, yeah.
okay.
Because you have to do the functional screening and you have to be a social worker.
Gotcha, okay.
Correct.
All right.
The other thing is, like, we do have the ability to do remote work or adjusted work schedules, but, you gotta be a certified social worker, and, like, you can't work from home every day. We don't have that capability, but I think the county allows people, or Human Services allows people to work from home like 2 days a week or something.
Even that makes a difference, especially with gas and stuff, that still makes a.
I know.
So between the weather and the economy, I think it's a good thing, even a couple days work, days and less wear and tear on your vehicle makes a big difference.
And honestly, we at the ADRC are we are really like a part of a team. We really rely on each other. Like, I'm the lead INA worker, but Rita, our elder benefit specialist, is so smart, and she is so educated about Medicare and Medicare supplements, and, you know, like, I think I know quite a bit about Medicaid guidelines and things like that, but she knows that Medicaid handbook like the back of her hand. So when I've got I prefer to work in the office myself, because all the tools I need, if I have questions, my people are there. Shelley Ruiz, our disability benefit specialist, and shout out to those girls, because it's benefit specialist week this week,
It
I
is,
think.
yay.
And Shelley's got longevity with the county, so does Rita. They just are really good tools to have in your back pocket to utilize. And so I prefer to work in the office. They all do too, but I think part of it is our age. Like, we are of the generation where we like to go to work. But not everybody is like that. And working remotely, you do still have the ability to
Right.
do Teams meetings and things like that with people, but
I think my generation and stuff, around my generation and millennials and stuff, I personally prefer the office, but generally my age group would rather work remote, so it's a difference.
Well, I'd shout out to Rita. She helped me when I turned 65, and I had no idea how to navigate Medicare.
I always tell people that Rita is the little diamond in the rough at the ADRC, that for whatever reason, people didn't always know about her, but we're getting the word out, and I think she's busier than ever also. Could also be the whole, like, everybody's people are retiring at record speeds.
Well, thank you.
The other thing is, like, a lot of people are choosing to retire early. Not everybody's waiting to be 65 anymore, so.
Retired early.
Thank you very much, Laura. We have a lot to think about after we leave this room. If you have ideas of social workers that could apply, get your bids out there for them. We need drivers, everybody on TV, spread the word as well as just the people in this room. So we hope that we can find them. I know it's throughout the entire country and probably the world right now that every organization is looking for more, whether they're volunteers or whether they're paid. It's a common theme, and I don't know that we can volunteer to leave this world to get rid, make room for the younger people, but us baby boomers are taking up some space.
Hey, we're
But
still working. We're still,
well, yeah.
we're still contributing.
yeah, those 12 organizations that I belong to, it's, yeah, it's interesting times.
You're
But,
saying that us as the younger generation got to step up, or what?
Sure. Big time, Kevin, big time. Got a lot of boots and shoes to fill. Yeah, I mean, there's not as many of you, I think, as what there used to be of us. So, and just a lot of positions to fill. So anytime you have questions, feel free to call. Melissa usually answers your voicemails and sometimes the phone. And so it's great. So thanks. Yeah, and her emails. Yeah. Thank you, Sammy and Laura and Jessica, for all that you guys do on a regular basis.
Put
And
your phone number out there for people who are listening so they can call.
It's on here, but we got to put it, gotta say on the color then.
If they're interested in being a volunteer driver, call 'em.
Great, yes, call the ADRC. So we have a 800 number, it's 800-273-2001. Or you can call us at 715-538-2001.
I hope your phone's ringing off the hook.
We do too.
so thank you, everyone.
Even more.
We've come to the end of our agenda, so our meeting is adjourned.
And we meet at 10:30 next
Next time.
Yep.
In August.
August.
Yeah.
Yeah, August.